I think when you do my job, as long as you've been doing it, to get a breast cancer diagnosis is not necessarily the shocking thing because it affects 1 in 8 women. And certainly I know I am not immune to it just because I'm a doctor. That being said, the shocking part was hey, you have 5 masses in your breast and there's a lymph node. And for someone that does routine mammograms. I go every January since the age of 40. I follow the recommendations I tell my patients. I do physical exams. I see my doctors. And I think knowing that in 1 year I got 5 masses and the largest was not considered small. It was it was above 3 centimeters, which is over an inch. Um, I thought I was going to die. Knowing what I know about cancer, the biology of it, and some tumors you can watch for a little bit, other tumors they just pop up overnight. And I certainly thought me being in the latter category, I thought I thought I was going to die.
So that's where your mind is as soon as you're hearing that.
I think my expertise, as soon as you become the patient, like it just kind of flew out the window. Because you're right. I mean, when you do this every day and you give patients statistics and you know the outcomes, and this is the good thing about breast cancer, right? I mean, even for more advanced stages, the numbers are really good. I mean, we are having really good outcomes because our treatments are so good. But then when you become the patient and then all of a sudden, and just to give you an example, I tell patients, hey, 95% outcome, statistically, you're going to do great, right? And as a doctor, you're like totally thinking, how can this patient not be happy with that? But then when all of a sudden you're told 95%, what goes through your mind is, okay, well, who's in that 5%? All I could think of with the statistic was I didn't look at it from the cup half full. I always looked at it as the cup half empty. So my knowledge was helpful because I knew where to go. I knew where to get my treatment. I knew what the treatment would be. I knew what the side effects would be. But on the flip side, the knowledge was not so helpful because in my job, I do see the people that fail, and I know the reality of what it's like to be someone that fails. And I think even though my outcome was good or is good, it's still hard not to perseverate on the other stuff. Even though they are relatively close in age, it's kind of like you had a high schooler, a middle schooler, and an elementary kid. So it wasn't like being able to sit down with them and have one
Right.
conversation. I had to break it up based on their level of understanding. And for the high schooler, his friend's mom actually recently passed from metastatic breast cancer. And I knew that would be fresh on his mind as I had to break this news. But what I found is, when I'm trying to navigate these conversations with the kids, I just had to really go at their level. So for James, the oldest, it was actually almost like I was talking to an adult in some way.
Right.
Hey, I have this diagnosis. And, I think his first question to me was, are you going to die? Because obviously with his frame of reference and you hear breast cancer, and I can completely understand why his mind went that way. And once I reassured him the best that I could and just said, hey, this is what I do for a living. We're going to treat this. It should be okay. And then he immediately went into like, okay, well, what are the treatments? What's going to happen here? What's going to happen here? He was once he kind of got reassured, I would be okay in the foreseeable future, then he could go into like, okay, give me the facts. And rather than kind of sugarcoat it, I just gave him the facts. And he was okay with that. The other two were not quite as straightforward. I mean, with my middle kid, I tell this funny story in the book how like I tell him and he whips out his phone and starts like doing homework, and we never actually had like with James, it was like, okay, like he said the word cancer, how are we going to do it? Right. And then with Sam, it was like, we didn't really say the word. I just kind of told him what was going on. And then his response was, okay, I'll start taking care of myself. That was how my middle schooler responded. And then my youngest, on the other hand, I had to say that was probably the more challenging one because he was starting to ask questions that there are no answers to. Like, well, what's death like? Is it dark? Like, what do you do in forever? Like, do you go to heaven? Lots of questions that there just are no good answers to. And you have to really lean into your faith and just kind of gently reassure him, like, hey,
Right.
got this. We're going to go through this together. And I can't. And honestly, I was I think I remember just being completely honest with him and being like, "I don't know the answer to these questions, but, and we'll get through this together." So,
So, yeah, and I think that's all we can do as parents, right? You try to safeguard them, but you want to be honest, and so you kind of just have to be as transparent as you can. So that kind of spurred you to say to kind of try to tell folks to do it, or to say, "Hey, this didn't work for me." Where did that kind of land you?
well, I think when I lost my hair and I realized, like, because we are very fortunate in this day and age for cancer care. We have such good supportive measures that many patients can actually get through chemo without having horrific vomiting or just, all these other side
Yeah,
effects that would mark a sick patient. Like, we
right.
have so many treatments that can actually mask that, right? So for me, my biggest thing was fatigue, but then the other thing was the hair loss. And the reason this was kind of my pivot moment was because if uh, I thought if I didn't lose my hair, right, I just have to take off a day for chemo and then I come back to work. But if I looked the same, like how I look,
It wouldn't identify. Yeah, people are, it's not going to define you. No one's going to know. My life is going to be perfect.
yes,
It's going to be what it was before.
exactly. And then after that first cycle, and my hair just, because I have really good hair, my hair was,
You do. You have beautiful hair, beautiful skin, beautiful hair. I already told you that.
but my hair was so thick that the cold cap couldn't penetrate down into my scalp, which is why I lost it. And as soon as that hair came out, that's when I looked sick. I did. I was tired, but I really felt okay, which is why I kept going to work. But then when people are used to seeing you a certain way, and then all of a sudden you don't look that way. And for me, because a lot of my presence is my hair, I mean, when people notice, like, what's wrong with your hair? What's wrong? And then
Right.
what's wrong with you? And then that's at that point I had to make a decision like, okay, do I hide it or do I do something with this? And I'm gonna but I tried to hide it in the beginning. Like I am not a surgeon, but I started coming to work in scrubs and scrub caps. Because if you walk into the room and they think you're a doctor and you wear scrubs and you wear a scrub cap, well, clearly you're coming from the operating room, which I wasn't. But that was in the beginning.
That was hard. So this was hard for you. The hair loss was
Yeah.
a hard thing for you.
Yes.
We're talking about a lot of loss
Yeah,
here.
and I don't want I think when a lot of people lose their hair, what they would first tell me is, "I don't wanna be vain," right? And initially, before I got diagnosed, I was like, "It'll grow back, it's not a big deal," right? And then when you go through it, you realize it's not about vanity so much, it's about the fact that, like, this disease slowly strips you away. I
Yeah.
the breasts, right?
Right.
I lost my breasts, and then my ovaries were shut down, and then eventually got my ovaries out, and then, while they were down there, I still took
Menopause.
out the
Yeah.
uterus. So I just feel like I
Yes.